seated. The record will show the presence of the jury, the defendant, and all counsel. Dr. Samuels, I'm going to continue to ask questions posed by the jury. In your years of experience, wouldn't you say low self-esteem is quite normal in the general population?
It's not normal, it's reasonably common, and it certainly should become a target of a therapeutic intervention, because self-esteem truly limits a person's ability to make a mark in this world. So I wouldn't call it normal. It's still an undesirable condition. It's not uncommon, but it's certainly not normal.
How do Jodi's test results go toward her diagnosis of PTSD if she was still telling the intruder story at the time of the test?
My diagnosis of PTSD was based upon the fact that she met the criteria as listed in the Diagnostic and Statistical Manual for PTSD. The tests, in my opinion, confirmed my selection of that diagnostic category, but the diagnosis could have been made without the presence of those tests.
Within the norm population used for a given test, if a segment of those individuals were to lie, could that cause a loophole, for lack of a better term, in that test that could possibly allow a client taking that test to lie without detection?
If the validity scales on a test were created with a group of people who lie regularly, it would certainly skew the results. But again, the PDS test does not have a lie scale or a validity scale built into it. The MCMI does, but that is based upon thousands of individuals taking the test and comparing their results with what else is known about those individuals. So when a test has a validated lie scale or an inconsistency scale or an exaggeration scale built in, that's a pretty good determiner of not whether they lie in general, but whether or not they're lying on that particular test. The scales that portend to detect lying in general are not very effective.
Is there an assumption that those in the norm population are answering truthfully?
Can you please repeat that, because it's a general question?
Is there an assumption that those in the norm population are answering truthfully?
Yes.
Isn't it possible that a hypothesis formulated early on could skew results when tests are evaluated by the same individual that formed that hypothesis?
Well, if the individual was not a trained psychologist or psychiatrist or mental health worker, it's possible. But keep in mind that the MCMI test was scored by a computer, which is the reason why I prefer to use computerized scoring when it's easily and readily available, and especially if there's any complexity to the scoring. And that way it serves as a second opinion to my decision-making process. The PDS can be scored by a computer program, but it's also available in a hand-scoring version. And because I don't use it as extensively as the MCMI or the MMPI, I chose to score it manually. But the test is constructed in a way that there are no decisions that I have to make in scoring that test. It's the client who writes down a number which corresponds to the degree and intensity of a particular trauma. I don't go ahead and change those numbers. I simply add them up, and the numerical value is what determines whether or not the diagnosis can be made. So there's very little room for error or bias in that type of a test.
Could that hypothesis affect or color how the evaluator reads or interprets tests, answers in interviews, interprets crime scenes, etc.?
The hypothesis that a evaluator makes is constantly changing based upon the availability of additional information. If a person's doing therapy, the hypothesis that is made is much more fluid because you are interacting with the individual and you're attempting to make some changes in the way they think or the way they behave. But in an evaluation, you may have an initial idea as to where it's going, but that should never guide your outcome. If anything, it may help you select the tests that you want to use for confirmation, but if you are a properly trained individual with the proper experience, it should not matter what your initial hypothesis was, as long as you don't take that hypothesis on and on and on and are unwilling to change it if the data shows that your hypothesis was incorrect. In other words, you don't get attached to your first ideas, your first guesses.
Based on the dissociative amnesia article, would you agree that 3 to 8 people out of 100,000 people studied is a very minute number?
That actually is referring to the transient global amnesia article that I was referring to. And I selected that article not because it's directly related to this case.
Question.
Sustained. Regarding the fight-flight response by Jodi on June 4, was there ever any discussion between you and Jodi regarding her response and why she did not flee from the bedroom?
Well, what she told me was that she did try to flee, and at some point she felt that she needed to protect herself. So I think that she did engage first in flight, and then only when threatened further in fight.
Is it your normal practice to fill out the answers on the questionnaire for those you are evaluating?
Sometimes I may do that for them, and sometimes not. Most of the time I have people do it themselves, but this particular case I filled it out.
Do you have any concerns with errors or incorrect responses?
No, my work was checked several times.
If a patient you saw consistently lied and kept to that story, then answered a test or series of questions based off of the story the client believed, how could that test reveal that they are lying, especially if that person remained consistent within the series of lies?
Well, if we were talking about the PDS test, that test result is not based upon the actual nature of the trauma, except for the case of the trauma being identified as a therapeutic goal. But a person who is evaluating their own level of stress for particular types of experiences they've had throughout a lifetime, you would find that it is somewhat irrelevant as to the exact nature of the stress, knowing that a stressor had occurred. In other words, their responses on the test are not so much to the actual stressor, or the details of the stressor, but whether or not they have faced situations in their life where they have been under stress. That's what you score and that's what you calculate.
You stated that Jodi answered number 13 on the PDS test the way that she did because of repeated physical and emotional abuse from Travis, and she explained this to you in your session after she took the test. When she took the PDS test, wasn't she still telling the intruder story and had not told her story about Travis's abuses yet?
Yes. No, she told me about his abuses early on, but not the actual incident of the killing.
Are questions number 16 through 21 on the PDS test based on the event listed in question number 14 in the time frame in question number 15, which would be the intruder story from 6 months to 3 years ago?
Yes, that's true.
If yes, this event never happened, so those answers, number 16 through 21, are based on a fictitious story. Is that correct?
That is correct.
Are these questions, number 16 through 21, part of the overall score to determine whether Jodi has PTSD or not?
Yes.
Do you feel comfortable with diagnosing a person with a condition if they continually lie to you, hypothetically speaking?
I would not make a diagnosis if I was aware that someone was telling me a lie. But her interview data, the crime scene data...
Objection beyond the scope of the question, generally speaking.
He's attempting to answer the question, so it's not left wondering what exactly he meant.
Overruled. You may continue.
Okay, could you please repeat the question?
Do you feel comfortable with diagnosing a person with a condition if they continually lie to you, hypothetically speaking?
Well, if I knew someone was lying and what they were telling me was unsubstantiated by anything else, and somehow I knew that they were lying, I would not make a diagnosis. That would be inappropriate.
Regarding question number 29 on the PDS test, not being able to remember an important part of the traumatic event, Jodi scored this a 1, indicating this doesn't bother her often. Considering that she killed Travis and claims significant memory loss during the event, doesn't it seem inconsistent this wouldn't bother her significantly?
If the memory has not been formed and it's not there, then thinking about it doesn't really occur. And therefore, she may have been reporting that she doesn't think about it, or the actual incident, because she simply doesn't remember it. So that would be consistent for someone with amnesia.
Given that the Time article mentioned that homicide suspects have reported memory loss, is it possible that a person can plan and carry out a murder and still suffer memory loss, acute stress disorder, or post-traumatic stress disorder?
Possible, but less probable.
Even if intentional, isn't it possible the event would still be considered stressful?
Is that referring to that same question?
Yes.
It's possible, but not probable.
If Jodi was in fight or flight mode when she ran out of the bathroom, why would she run into the closet and corner herself?
From my understanding, the closet had 2 entrances. It was a pass-through between 2 rooms. And so I don't think she viewed it as a place to hide so much, but as a place to walk through or run through in order to run away from Mr. Alexander.
Wouldn't someone in fight or flight mode want to get away from the danger?
Usually that's the first step, but if you can't get away from the danger, then the next thing to do is to fight.
Would they want to get help from someone?
Well, I think based upon the intensity of the trauma, if one's life is being threatened, I suppose that if there was somebody in the adjacent room to call, maybe that would have resulted in a shriek or a shout, but she seemed to have been there alone with Mr. Alexander, and this is all going on in milliseconds. She survived on a mechanical basis, an instinctual basis, and the way she handled it was the way that came out of her. Again, to make a phone call or to run out the house if you can get away, running for help takes longer. And while that's possible that someone may be able to do that, apparently under these circumstances, that was not an alternative.
Are you able to state that Ms. Arias had either PTSD and/or acute stress disorder before the incident on June 4, 2008?
I can't determine whether or not she experienced an acute stress disorder at another point in her life, and whether or not, if she may have been diagnosed with PTSD at that time, although from what I was learning from talking to her, many of these symptoms occurred after the incident had occurred, such as the emotional numbing, the physiological reactions that she was experiencing, etc. So while it is possible that she might have been diagnosable with PTSD, I didn't see the likelihood that that was the case.
Would someone who plans to kill another and does be less likely to suffer acute stress than someone who kills an individual accidentally?
Accidentally? Well, if we're referring to something like a hunting accident, again, you're not, if you accidentally shoot somebody in the woods, you have a very lower likelihood of falling into a flight or fight response. So the likelihood of developing an acute stress disorder is probably less for that type of circumstance than if you were planning to kill somebody. But on the other hand, if the killing occurs within the context of an argument or a fight, or is emotionally charged and comes up suddenly, there's a greater chance that someone will enter an acute stress reaction or develop an acute stress reaction.
Is it possible that Jodi didn't write negative things about Travis because there was nothing negative to write?
While possible, that would be inconsistent with what I learned later on about the nature of their relationship, and in seeing some of the text messages, in listening to some of the telephone calls between the two of them, or the telephone call between the two of them. There was an indication that it was a rather tumultuous relationship. And so, therefore, while she didn't write about these things in her journal, that was consistent with her style of glossing over difficult times with Travis that was supported by other information that was made available to me.
If one has suppressed feelings repeatedly, would it be a natural reaction once the dam breaks, for example, a gunshot that hits Travis, for all the repressed feelings to express themselves in carrying that violence to the extreme, overall of stab wounds?
Could you please repeat that again?
If one has suppressed feelings repeatedly, would it be a natural reaction once the dam breaks, for example, a gunshot that hits Travis, for all this repressed feelings to express themselves in carrying that violence to the extreme, overall of stab wounds?
Yes, that is a characteristic of an emotionally charged killing.
If something is premeditated, is amnesia more or less likely to occur?
I would say less likely to occur.
You stated that Jodi did not have control of what her mind was doing during the killing. If that is true, how do you explain her dragging Travis's body and trying to clean up the crime scene?
The attempts to clean up the crime scene appear to be rather frenzied, disorganized, impulsive, and not well planned or thought out. These are characteristics seen when someone is in a state of acute stress. If you would predict that if someone had planned this terrible deed, that plans would have included cleaning up the crime scene in order to get away and reduce the risk of apprehension. But that was not the case in this particular incident.
In earlier testimony, you stated that once you found out the true story, you should have retested for PTSD, but didn't because it was an oversight. Just now, you said you didn't retest because you believed her score would remain the same, which is correct.
When I was being questioned on Monday, I must have been, I admit, I was a bit thrown by the veracity of Mr. Martinez's questioning.
Sustained.
So I was a little thrown. First of all, there is no set procedure that would require me to do a retest. In terms of my later analysis, after it was made clear that I had tested her prior to the story, I reviewed the material and made the determination that the score would have been essentially the same. There is no set requirement that I test to begin with, and there's no requirement that I need to retest either, nor is there a requirement that I test at all. The diagnosis was an initial hypothesis, and it was reinforced not only by the PDS, but also by the MCMI and all subsequent information that I learned about this case.
Was there anything in the book you gave Jodi that would alter her responses to test questions or your questions?
No.
How can you be sure that Jodi did things to please Travis when you didn't have a chance to speak to him?
Could you please repeat that?
How can you be sure that Jodi did things to please Travis when you didn't have a chance to speak to him?
Well, I reviewed text messages, emails, her writings. I listened to a tape that was made between the two of them, and it indicated to me that she had a very weak response to what many experts or individuals would view as abusive behavior.
How do you know that she didn't kill Travis out of jealousy?
How do I know that? Only from writings and a conversation that they had, for example, on the phone, where they were discussing the fact that they might be marrying other people. Her writings did not indicate a strong degree of vindictiveness. She, in fact, was planning to visit another man in Utah on the day of the crime because she was hopeful that a relationship might start with him. Not the typical thing that an overly jealous person would do. Is it possible that she was a little jealous? Of course, but I don't believe, based upon what I've read, that that was the predominant emotion.
Are acute stress and PTSD the only diagnoses that would present the criteria in the DSM-IV book, or do those criteria appear in other possible diagnoses?
Some of the criteria may appear in other diagnoses, but the only place the PTSD diagnosis constellation appears is in the section of the DSM that defines or describes PTSD. While the diagnostic criteria for an acute stress disorder are similar, they are not identical, but they do have a great deal of overlap. But by and large, if a person meets the criteria of PTSD, it's unlikely that any other set of criteria would be met in full. Now, one of the characteristics, for example, of PTSD is an elevated anxiety level. That could also diagnose the individual with an anxiety disorder, which is in essence what I did.
Ladies and gentlemen, do you have any other questions? It appears there is one additional question in the basket. Are there any others? Counsel, please approach. You just stated that Jodi's physiological symptoms did not appear until after the event on June 4, 2008. Did she ever talk about those type of symptoms occurring prior to June 4, 2008?
She did indicate to me in one of our conversations that there was a time when she and Mr. Alexander had an altercation. And I believe it was the altercation when he purportedly pushed her down to the ground and choked her. From that point on, she said she would fear him at times, especially when he got angry, and she would begin to either shake or have sweaty hands. But but those symptoms began to occur with greater regularity after the actual killing incident.
Follow up from the defense.
Good afternoon, Dr. Simmons.
Good afternoon.
You were just talking about the physiological symptoms that she reported. One of those the shaking or tremors.
Yes.
And did she talk to you about those? Why did those occur? Why did those begin to occur?
She indicated to me that they occurred after an incident with Mr. Alexander when he pushed her down and choked her. And from that time, his anger became associated with fear, and she reacted. One of the reactions was to experience the tremors.
All right. And with regard to the anger and the fear that she felt, is this something that she described for you from the beginning of your meetings?
Yes.
And is this something she talked to you about even though she was still telling the intruder story?
Yes.
Okay. So when you first met with her, was she being forthright to you about beginning to talk to you about the relationship with Travis?
Yes.
I reused another word.
Yes, she began to describe details of the relationship with me from the very beginning of our contacts.
All right. And then after, when she told you what she says actually happened on June 4th of 2008, did you still talk to her about her relationship with Travis?
Yes, because they were additions to what was being told to me. She had made that breakthrough and was revealing more to me at that time.
Okay. You were asked the question about how can you be sure that she didn't kill him from jealousy. Do you remember that question?
Yes.
And you talked about some of the things that that supported the idea that there was no jealousy involved. Is that right?
Yes.
Did you listen to a tape recording between Mr. Alexander and Miss Arias?
Yes.
And in that tape recording, did they discuss marrying other people?
Yes.
Did they discuss whether or not Mr. Alexander was actually going to go to Cancun?
Yes.
And when they're talking about Mr. Alexander going to Cancun, did Miss Arias ever say anything negative to Mr. Alexander on that tape?
No, she did not.
Did she ever on that tape express any dismay that he was not taking her?
No.
You said you reviewed journal articles as well, right?
Yes.
And in her journal articles, do you recall her speaking specifically about Mr. Alexander not being the person to marry?
Yes, she did mention that in her writings.
And did she talk about that they were going to move on from each other and marry their own people?
They did say that she said that in her writings.
And what I mean is marry different people.
Marry different people.
Okay. You said that she was, the trip, ultimately starting on June 2nd, she was going to visit another man.
Yes.
Were you aware through text messages and speaking with Jodi, were you aware that she was already cultivating a relationship with this other man?
Yes, I'm aware of that.
And was she speaking with him through text messages and phone
Yes.
calls? And she was doing this prior to the trip to Utah, wasn't she?
Yes.
Are you aware of her moving away from Mr. Alexander?
I am.
And once she moved away from Mr. Alexander back to California, did you review text messages during that time talking about how good she felt?
Yes, she said that she felt better being away.
And is that in any way indicative of jealousy?
No.
You just were talking to us about being thrown during testimony, talking about the PSD test and whether or not you should have given it again. When you had some time to review the answers on the PSD test, knowing what Jodi tells you happened on June 4th of 2008, do you have any concerns that PSD test would have come out not supporting PTSD?
No, I believe that there's an extremely high probability that the score would have remained the same.
Is it possible that the score could have been higher?
It could have been.
And with the PSD test, is the concern what the facts of the trauma or whether there is a trauma?
What it's measuring is whether or not there was a trauma and how seriously did that trauma affect you and in what ways. But the specificity of the trauma is really more of a therapeutic issue. Given the fact that both were terrible, the original story was bad enough, but the real story was even worse. So you would anticipate that the trauma would have been even greater.
And is there any doubt in your mind that she suffered a trauma on June 4th of 2008?
No doubt whatsoever.
And so if she suffered a trauma on June 4th of 2008, the answers on that PSD test, are you confident in the results?
I'm confident enough for the purposes I used the test for, which was basically to confirm my decision to diagnose her with a PTSD diagnosis.
And you talked a little bit about that. You talked a little bit about making a hypothesis first.
Yes.
Do you remember that?
I do.
All right. So when psychologists or doctors need to make or diagnose somebody, see if there's something wrong with a patient, Do you walk in and give them a battery of tests?
That's not typically how it's done, no.
Why not?
Well, you don't know what tests to give. The purpose of tests is to refine your initial hypothesis. And so the first few interviews are very important in helping you formulate your thinking. Now, with a certain amount of experience and having worked with many people who have these disorders, it becomes relatively easy to recognize the presence of PTSD, because in your mind, you're comparing what they're telling you and what's going on with them with the criteria from the DSM. So as soon as as I had indicated earlier, I had a previous diagnosis, perhaps a dissociative identity disorder. I eliminated that one as we spoke further. So PTSD came up next. I began to ask questions over and over again to make certain that was the case. Then I administered the 2 tests, which supported it, and that confirmed the diagnosis for me.
You also mentioned that whether or not you gave the test, would you still feel comfortable diagnosing Jodi with PTSD?
In most of the therapy work that I do, we don't do psychological, I don't do that much therapy anymore, but we didn't do psychotherapy routinely, in part because the insurance companies were reluctant to pay for testing. In those cases where I did use testing, I would very often administer it several weeks into the work, not so much for the diagnostic purpose, but to get a little bit more second opinion about that individual's certain characteristics, such as their personality, their emotional state, the level of anxiety, and so on, which I would use as a second opinion. Because when you do psychotherapy, you work on your own, you're pretty much on your own. And in order to reduce the risk of bias or heading off in the wrong direction, the use of a psychological test can serve a useful purpose.
Okay. You talked about experience, and that experience is helpful when talking with a patient or a client about when they're talking to you about their experiences and their symptoms.
Yes.
Do you think it's similar to a medical doctor when somebody walks into a medical doctor and says that they have pains somewhere? Doesn't that medical doctor want to know where the pains are first before they send the person out for tests?
Absolutely.
His medical expertise.
Approach. Sustained.
In times past, when you have visited a doctor, do they immediately send you out for testing, or do they ask you questions first to know what kind of medical test to give you?
Well, the proper approach would be to learn as much as you can.
Not answering the question.
When you visited a doctor, generally speaking, when you've gone to a doctor, do they want to know what your symptoms are first before they send you out for maybe an x-ray or something?
Of course, yes.
Okay. And is that similar in the world of psychology?
Yes, we ask for the presenting problem or the issue that they would like to deal with in therapy. And if we feel that testing is appropriate, we might order a test. Certainly, we would delve into an area that is of greatest concern to the patient.
All right. And so when you have experience, such as the amount of experience that you have, 35 years, does that come into play when you're listening to these people talking about their symptoms?
Absolutely. A well-experienced physician, psychologist, is able to listen to the story of the patient and probably with greater clarity have a better idea as to what the problems are with that individual because they've seen it before, they've heard it before. Now, your diagnostic procedure doesn't stop there, but at least you are probably likely to more quickly zero in on the actual problem of the individual because you've heard it hundreds of times before or dozens of times before. And I noticed that in my own practice as well.
Okay. You were asked the question, in a fight or flight situation, why would Jodi have run into the closet versus running out the door? In that type of situation, when a person is in fight or flight, are they able to make higher level decisions?
You know, the better analogy, I think, the best analogy for what happens during fight or flight is to imagine an animal who is frightened, running away from the source of the fear, and then finding itself cornered, fighting back. And this is going on without a lot of conscious planning and decision. And when a person is in a fight or flight state, the old part of the brain, that central core of the brain, is what predominates because the cerebral cortex, the area of the brain that's responsible for our higher level thinking, is not functioning properly. So the first thing to do is to put distance. That's the first built-in instruction. Put a distance between the negative situation and yourself for safety. So you run, you flee. Which direction do you go? It's hard to determine that. If you've had experience, for example, running in one direction, but in the past you've been trapped in that direction, well, maybe subconsciously your body chooses to go into another direction. It's hard to predict. It's hard to know exactly how a person is going to behave because the behavior isn't rational. So from what I understand about the construction of that house, the closet was not a dead end. It was a passageway between two rooms, and it offered an egress from the situation. So it's consistent with fight or flight.
Okay. You said that often people want to put distance between the attack or the fear and themselves. Did Jodi talk to you about wanting to put distance between herself and Travis?
Yes.
And you said something about past experiences that can make a subconscious difference?
Yes.
Did Jodi ever talk to you about trying to get out of that room in another time and Travis catching her before she could get to the door?
Yes.
Is that something that matters in her body? Not necessarily her conscious decision making, but is that something that would matter during a fight or flight situation?
It could. If there was an experience where an attempt to escape was made, certainly from what I've read and understood and what I was told, it didn't lead to a total acute stress disorder, but it was a negative experience. It's possible that the motor learning, the motor conditioning, or the reflexive type of conditioning became somewhat stronger to flee in a particular direction, a direction different from the one that didn't work the first time. Now, this is a hypothesis that I'm making, and so I don't know for sure, but it's possible. It's entirely possible that that's why that happened.
All right. And you also said that behaviors are not rational during a fight or flight situation. So we can sit here and guess all day, right, about whether or not why did she turn to the closet versus turning to the door. But ultimately, if there's irrational behavior happening during a fight or flight situation, I mean, is it possible that people would never know?
That's true.
Or never an explanation?
No, any explanation, you're explaining something that is below the level of consciousness. It happens. We don't know why. Even if we look back at it within the context of what we know about the individual, we can never be sure. And we can never offer a clear-cut, 100% guaranteed explanation of why someone did A instead of B.
But what you do know about a person being in the fight or flight situation is that their decision making. What do you know about their decision making?
That the decision making is basically occurring on the instinctual survival level. It's typically not associated with higher level processing.
And when you talk about not behaving rationally, can you look at situations to see if they seem like they were rational situations or not?
Yes.
And a photographer leaving a camera in a washer with all the pictures showing that she was there that day, is that something rational?
Objection, lack of foundation, mental state.
It's not a mental state question.
You may continue.
Thank you. If somebody is in the fight or flight situation and you're telling us that their behavior is not always rational, then would it be rational? Would it be considered rational then in that? Well, is it rational for a person who is at a crime scene to leave evidence behind that they were at the crime scene? Is that a rational thing to do?
No.
Is that something that would be considered irrational?
I would, yes. I would consider it irrational.
And if they're leaving information at the scene that leads detectives right up to them to say that you were there, is that something that is well thought out?
No.
You were asked questions about, one more question about that. With regard to asking for help, you said it would be something that a brain in a fight or flight situation would not stop to make a phone call. Is that what you said?
There was no time either. You know, when you're under threat, and milliseconds count. So to interrupt what you're doing, pulling out a phone and dialing someone, or 911 or whatever, is not in itself possible under those circumstances. Besides which, when you're in a fight or flight situation, you've probably seen this in the movies, people get very nervous, they can't press the buttons properly, they're not thinking. They are awash in instinctual, reflexive behaviors and thoughts and feelings, I should say. And doing things that are more rational, which require planning, generally do not occur under those conditions.
And to your knowledge, based on your review of the police reports, was anybody home at the time that this occurred when this happened with Jodi?
No.
So there was no one there to help her? Was there anyone there to help her?
To my knowledge, there was no one else in the house other than Mr. Alexander and Ms. Arias.
Okay. You were asked questions about, would you be comfortable diagnosing a person who continues to be untruthful? Do you remember that line?
Yes.
And have you had that situation happen to you?
Only with some adolescents, and then I ask their parents to come in, and usually we resolve it, but there have been a few cases where I've sent them elsewhere. But at least in a therapeutic situation, people are paying good money and giving of their time and commitment, so it's less likely that they're going to be anything but honest. But I have had some circumstances like that. Sometimes people are embarrassed to reveal, which is one of the reasons I don't tape, because people are more likely to open up if they feel they're just talking to a person and their words are not being recorded for posterity.
And when you have those situations, what do you do?
Well, you say, listen, there's some inconsistencies in your story, and I want you to think about why it is that you're telling me those things. Is it something that you're embarrassed about, or are you, basically you confront them in a gentle, assertive manner, but not in an aggressive manner. And hopefully that will give them enough opening to begin to revise that. Say, listen, are you sure that's the way it really went? Because I seem to recall this and that. And, you try to engage them in a friendly conversation, and you usually get far more information. As they say, you catch more flies with sugar than with vinegar. So the idea is to engage them and make them feel comfortable. However, there are times, especially with rowdy adolescents, where they may be resistant. They may be fighting the therapy. They may be there only because their parents want them there. And in those cases, I would have to say, after a period of time, maybe you really need to see someone else. But of course, you take the intervening step of dealing with the parents.
Okay.
But most adults don't do that.
All right. Did you ever have that problem with Jodi?
No.
And what about when she was telling you the intruder story?
Objection, characterization, coaching.
Approach. World.
So what about when she was telling you the intruder story? Did you have to have these conversations with her about gently confronting her, or what did you do?
Initially, the most that I would do is say, are you sure that that's what happened? But I didn't want to push it because I was taking the view that this was likely a psychological defense mechanism. And I didn't want to push her into having confront the very stimuli that I hypothesized would have caused this new alternative reality. However, on her own, she finally changed her story. What those factors were, I don't know. But then when I went back to her after she did make the revelation and began questioning her, I found a different demeanor. She told me that she felt that a tremendous weight had been lifted. She began to reveal more details about the story. And at that point, I began to expand what I wrote. I didn't have to revise my diagnosis because I had made the same diagnosis earlier, although the incident was different. Trauma was different, but this was an even more intense trauma. And I had assumed that there was a greater trauma than she was originally telling me anyway.
Okay. So is there a difference then between the adolescent who is just simply not cooperating with you or lying to you and the situation that happened with Jodi when she's talking to you about the intruder story?
No, I believe that the intruder story was a psychological defense mechanism. It was the manifestation of a psychological defense mechanism to protect herself from having to deal with the situation that caused her so much distress.
Okay, and when you have that adolescent who's just not willing, is that, do you characterize everything as a defense mechanism?
No.
Okay.
Not at all.
Okay. And why did you think it was a defense mechanism? Why did you have that hypothesis or
Well,
that
in
opinion?
a diagnosis of PTSD, you find that an individual will very often try to avoid dealing with the stimuli that bring them in contact with the emotional characteristics of what they went through. And I saw this as a very well-constructed, but well-constructed defense mechanism. This was her way of dealing with it. It didn't happen. Somebody else did it. Whereas all the evidence was pointing to the fact that she did do it. But she couldn't deal with that because it was so horrific and so antithetical to everything that I read about in her writings that she simply couldn't face it and couldn't come clean until adequate time had passed. Maybe she reprocessed her thinking. I really don't know what brought the change about. But if it was therapy, it would have been considered a therapeutic breakthrough.
And just to be clear, it wasn't therapy, is that right?
It was not therapy, no.
Okay. You were asked the question, if a patient lied consistently and then take the PDS test, if it's not, would that be then a fictitious result? And I know we've discussed it somewhat, but you answered in that particular question that the PDS is not based on the nature of the trauma. What do you mean?
Well, in other words, there are several different traumas listed there. But if a trauma, in a sense, is a trauma, there was a murder committed. She was witness to that, at least, the least of the traumas. And she was frightened and terrified and felt her life was threatened.
You're talking about the intruder story.
I'm talking about the intruder story.
Okay.
So I knew that there had been this incident. So I realized that, indeed, according to her story, which I didn't fully believe, her life was threatened. She was the witness to a horrific crime. Those things would have remained the same, whether she was the actor in the killing or whether or not she was an observer, a sole observer, an observer of the killing. So when she finally came through and told the right story, I can only surmise that the trauma that she experienced was actually worse than it would have been if it was the actuality was the story that she had made up.
Okay. You were asked questions about the MCMI and the validity scales.
Yes.
And when was the MCMI test created?
In the 1970s, I believe.
Okay, and how long does it take to create a test like this?
It can take 10 years, and it's constantly under modification. New norms are being developed. They might start to validate it against different populations so that it broadened the validity of the test. Sometimes tests have to, this is, by the way, MCMI 3 means this is the third version of the test. Soon, I suspect, there'll be an MCI 4. Sometimes the way the items are written have to be modernized. So instead of talking about a phonograph, they might talk about a music player. And but although those items don't exist on the test, I'm using that as an example. So sometimes, for various reasons, the tests go through an evolutionary process. When they reach a point when they're not similar enough to the former version, then you come up with a new version.
Okay, and so you were asked the question about what if the normed population were able to lie on the test, originally when the test was being created, would that create a loophole for people taking the test? My question is let's start first with what's the normed population?
It's a population, and the test is constructed, if I may explain how the test is constructed.
If that makes it easier to understand.
It does make it easier. The items on the test, and there was a pool of many more than 175 items, although they ultimately selected this 175 items based on the items that best correlated with the diagnostic criteria, were given these items, and an analysis was done of how these people with a particular type of diagnosis answer these items, these questions. And so through a complex computational process, certain items are selected, and constellations of items and the relationship between scores and scales allows the test to make a prediction that if somebody who has never taken this test before scores in a manner that is similar to the pattern responded to by people with a known diagnostic category, then we can say that these people have characteristics similar with people with that particular diagnostic category. And this is a very complex and long process. Okay. But nonetheless, the final test allows us to take a standard group of items, ask people to respond to them, and then, using the algorithms that are used to compare and contrast these different scores, make predictions as to what type of diagnostic category is this person responding most like compared to the sample group that we knew for sure had that particular diagnostic category.
Okay, so that's my question. So the sample group that originated the test, that was created, or the sample group that was used in creating the test, that sample group, the question that you were asked is, if that sample group lied, would it create a loophole for later on when people are using this test? What my question to you is that even possible?
I mean, these people who develop these tests are very smart, and No, that's not really possible.
And if it were somehow possible, are we talking about thousands of people getting together and conspiring to answer the test in a certain way?
You'd have to train people to answer in a way that distorts the result. It's a very unlikely proposition.
Okay. The validity scales on the MCMI test. What are they testing for? The validity scales.
Well, they're looking at consistencies between similar items. In other words, sometimes the items in the test are offered several times at different points during the test. They might be slightly reworded, but we're looking for consistencies in internal consistencies. There's one item in either the MCMI or the MMPI, and I'm deliberately mentioning both because I don't want to give an item away, that says I've traveled across the Atlantic 30 times in the last year. Well, if you're answering in a random process, in a random way, then your answer might be, yes, I have. And very few people have crossed the Atlantic 30 times in the past year. Maybe there's one person who's been, some people may do that, but not too many. And so items like that are placed within the body of the test to detect distortions and lying and a lack of consistency. In fact, one of the statements the test makes is that the person responded consistently to several similar items placed at different points in the test. And again, these test constructors are very clever about what they do. And however, they can't tell on an absolute basis whether or not that person has ever lied before, or they're lying about something unrelated to the test. You're dealing with the sample of items in the test and not beyond that.
Okay, so the validity scales, when we're talking about catching someone not being truthful, is that not being truthful with regard to the questions on the test?
Yes.
Okay, and the questions on the test, are they developed to learn about people's personalities?
People basically endorse certain beliefs or concepts or ideas that the test developers have found have served a useful discriminating function.
Okay.
And the selection of those items is first done by using what we call face validity. We choose items that we think might be differential, and then we narrow. When we say we, I have not developed a test. It's not my area of expertise. But eventually, by using correlational techniques, we're able to remove the ones that are not as useful in predicting and focus on developing a test with as many highly correlated items as possible.
Okay, and so when you're talking about the questions, the correlated type questions, these aren't factual questions?
No, they're not. They're not factual questions.
Okay.
Like there's another, this is not a real question, but one similar to it in one of the tests that I mentioned. I like sports magazines. True or false? Why is that important? Well, it turns out that certain people with certain diagnostic categories may tend to prefer sports magazines. Now, that one item by itself means nothing, but in conjunction with 567 other items may mean something. Okay. That's just an example.
Okay. So the validity scales are telling you if that person is reporting honestly with regard to the questions on the test?
That's right.
All right. You were asked a question about whether or not the incident with the rope and her being tied with the rope, if that occurred on the day of the killing on June 4th.
Yes.
Okay. Did she speak to you also about another time that she was tied up with the rope?
Yes, she did.
All right. So there was more than one time.
Yes.
And on the day that she and Travis had used the rope on the day on June 4th, did he use a knife to cut the length of the rope?
Yes, that was what was reported.
Okay. You were asked questions about low self-esteem. About low self-esteem and whether or not it was common or normal in the population, general population. You said it wasn't normal, but it can be common. Is that right? Or not uncommon?
It's not uncommon.
Okay. So when you first meet with Jodi, is that something that you could see in her right away?
Well, I can't see it just by looking at her.
Okay.
But after speaking to her at length and having, of course, read much of the material, with the experience of many years of working with people who have low self-esteem, you can pretty quickly determine that. You can sometimes determine it very, very quickly, depending upon eye contact. You can determine it by the strength of the voice. You can determine it by the way they look or not look at you when they're talking. But there are other things that are being said in terms of their explanations of solutions to problems that they have had. There are confident, assertive solutions, there are aggressive solutions, and there are non-assertive solutions. And so after speaking to that individual, you begin to catalog those, if not on paper, then in your brain, and you form an opinion. And my opinion was that she was not a self-confident person.
You talk about assertive and aggressive. Is there a difference between the two?
Yes.
What is the difference?
Well, aggressive responding is that when someone becomes belligerent, they raise their voice, and they attempt to parent the individual, the other person that they're talking to, into submission, almost like an angry parent would be lecturing a child. Whereas an assertive person can get their point across in a rational, friendly, adult-to-adult level. They get the same point across, but they're maintaining adult-to-adult relationships. And that all goes back to an area of parent-to-child relationships, and I won't go into it.
Okay. All right. Is low self-esteem, is that related at all to assertiveness or lack of assertiveness?
Yes, people who are experiencing low self-esteem frequently are not assertive.
And you were asked the question about whether or not if a person was able to confront a boyfriend after cheating on her, is that sign that she's an assertive person? Along with that question was if a person is able to confront another woman who was cheating with her boyfriend, is that a sign of an assertive person?
It depends upon the nature of the interaction. And the fact that Jodi may have spoken to another girlfriend of Mr. Alexander, but didn't do it belligerently, and was basically just speaking to them, may mean that that was a somewhat more assertive act than she typically was capable of engaging in.
Well, let me clarify for a second. With regard to talking to the girlfriend, do you remember her talking to you about a boyfriend named Matt?
Yes.
And did she ever talk to a woman named Bianca, who Matt was seeing?
Yes.
Okay. And so in that situation, if she was able to go and speak with this Bianca person and talk to her about the fact that Bianca was seeing Matt at the same time that Jodi was supposed to be still dating Matt, that's what we're talking about with regard to assertiveness. Does that mean that she's assertive because she's able?
No, it doesn't. And people can be assertive to certain people and not to others. For example, I had a gentleman in therapy who was the CEO of a major New York manufacturer of women's coats. And he probably had 1,500 to 2,000 employees working for him. And he came to see me because he was having trouble dealing with his mother. His mother dominated his life, yet he controlled 1,500 employees. And this was a dilemma for him. He was assertive in the world that he created as an adult, but when it came to the parent-child relationship, he was still the child and his mother was the parent. So the therapy dealt with him becoming more assertive with his mother. So it's perfectly not unusual at all for someone to be assertive in one area and not in another. Ms. Arias was not assertive with Mr. Alexander, in part because she viewed him as being so much superior to her.
And if she was able to, are you aware of a time when she walked in, when she saw him making out or kissing another woman?
Yes.
At a time that he was supposedly trying to get her to become involved again with him?
Yes.
And are you aware that she spoke to him about it a day or so later?
Yes.
The fact that she was able to do that, to bring it up to Travis that, hey, I saw what you did, does that make her assertive again with Travis?
It may have been a little peak of assertiveness at that particular moment. I don't know the exact confrontation, the nature of the confrontation, but a lot of women wouldn't put up with a continued and ongoing pattern of interaction that was reported to me in the conversations and reflected in the emails, the text messages, and so forth.
Well, let's say that just 2 months before that, before this situation, they broke up because Miss Arias believed that Mr. Alexander was cheating on her. And then 2 months later, she sees him kissing another woman at the time that he's supposed to be trying to date Miss Arias again. The fact that she's able to speak to him about it, you said, is like a peak of assertiveness, right?
Yes.
What about the fact that she, when he apologizes and says he'll change, she stays? Does that say anything about her?
That indicates that her confidence, she's not respecting herself adequately. Self-respect goes hand in hand with self-esteem. And if you love yourself, if you respect yourself, you're not going to allow anyone to take advantage of you over and over and over again. And she was unable to do that.
You talked about the question was the D2 criteria for PTSD, which was irritability,
Yes.
and that Jodi reported that she would be irritable on the phone with her mom.
Yes.
With regard to that, and you talked about her showing anger towards her mom.
Yes.
Was she able to show anger to anyone else? Did she have that type of assertiveness or self-esteem to be able to do that?
Rarely.
Was she ever able to show that to Travis during their relationship?
If at all, infrequently.
And if she did ever stand up to him, did she talk to you about what his response would be?
Well, she reported several times that she would be punished for speaking up to him by him not calling her for several days. And because of her low self-esteem, she began to fear that he was going to abandon her. And she would wind up almost in a panic after him not calling for several days. Now, that can happen once, that can happen twice. But from what I understand, from what we talked about, from what I read, and so forth, this was a fairly common ongoing practice, at least early on in their relationship. It was a form of control. And you see that type of control in situations where we have the classic misogynist, and so on, and it's in the books. You could read about that in various textbooks.
When you have a class, I'm sorry, did you say class of what?
Misogynists.
And what is
the males that take advantage of women in that fashion, control women in that fashion.
Okay. And does that explain why then, if there's a period of time when he doesn't call and she goes into a panic and then he calls and she goes right back to him, is that consistent with what you're telling us?
Yes, exactly. Very consistent.
How so?
Well, that's a pattern that you see in many relationships where we have a woman who has low self-esteem and we have a man who tends to dominate and control. And part of the control is the withholding of love. Somehow he's able to figure out, if I withhold my love, I'll get her to do what she wants. And this seemed to be the dynamic of the relationship, from what I was able to ascertain through readings and text messages and the writings and so forth. I did not see it, obviously, but that's what it sure sounded like to me.
Okay. You were asked several questions about sending the book, the $9 book.
Yes.
The self-esteem book.
Yes.
And one of the questions asked you about a fond relationship, and I believe your answer was that you did not consider it a fond relationship. Is that right?
I considered her my client, someone that I was going to evaluate.
All right. With regard to sending someone a book, did you say that you've done that before?
Yes.
With other patients or other clients?
Yes.
And in doing so, does that indicate any type of relationship, improper relationship between the two of you?
Well, I've never thought of it that way. No one has ever said that to me before. So it's not at all improper.
And when you would meet with Miss Arias and with your sessions with her and you're evaluating her, did you sit down and chit-chat like friends?
No, I was her evaluator, and she was the person I was evaluating.
All right, so did you have a purpose in the conversation that you were having?
It was always directed and aimed at getting specific information, whatever it was that I happened to deal with on that particular day, or sometimes I would review things that needed additional clarification, or sometimes I would pick up where we left off before.
All right. Speaking of the conversation, you were asked a question about leading questions, questions that suggest an answer to her. Is that ever appropriate when you first meet a client to suggest to them what you want them to say?
No, in fact, we are very well trained at interview techniques, and that's one of the basic things that a psychologist is trained in, whether you're dealing with a patient or whether you're dealing with a client under evaluation. We learn not to use leading questions because that does distort and it does bias the interview. It's almost as if someone's in a sailboat trying to go this way, but you put a fan on to blow them this way. You're directing them off course, in the direction very often of what you want them to talk about. For many years, until the training had improved, many children who were interviewed by police that may have been molested were given leading questions, and they would come up with accusations and responses that were simply not true because they were led. But not because the person doing the interviewing knew what they were doing. They were unaware that this was happening. So the training now attempts to overcome that.
So is it something, so even if you're unaware of it happening, is that why you have to have training to make sure you're not doing it by mistake?
Absolutely. It's easy sometimes to lead if you're not aware of it and you're not trained.
Okay.
And the training is very extensive.
What kind of training?
Well, it requires you to do mock interviews with the professor or the supervisor there to guide you, or you observe tapes or videotapes or films in those days of interview techniques, good ones and bad ones, and that's part of the learning process. And then we do workshops where we interview one another, and we're critiqued on the nature of the interview. So it's a whole process and can take it's a long time to learn.
And then besides the training, do you put your experience behind that?
Of course, you put your experience behind that, and the more years you're doing this, assuming that you have periodic refresher training, you learn to just organize your thinking so as not to engage in leading questions. Now, there may be one or two times when you need to do that. If someone's going tangentially, they're off course, you have to steer them back, and there are ways of doing that as well. But as long as you're aware of what you're doing and you can control it, you don't allow them to go too far.
Okay. You were asked questions about leaving out the importance of an accurate report.
Yes.
Obviously, do you think writing an accurate report is important?
Yes.
And when you write an accurate report, are things that are important to you always the same that might be important to lawyers or police?
No.
And so with regard to the relevancy of the anal intercourse, the importance of it to you was what?
The importance was that it was a pattern that was ongoing. It was something that she accommodated Mr. Alexander in order to maintain the relationship. And while she didn't object, it was not always pleasant for her, according to what she told me. It wasn't something she was getting pleasure from. The fact that it may have happened a couple of times with some other boyfriends, but only a couple of times, suggested that she had more power, more control, more assertiveness in those relationships, or the men respected her more than Mr. Alexander did in the relationship, where this was something that she accommodated him as opposed to enjoying it.
And so so the fact that you did not include in your addendum the additional information that she had experienced anal intercourse a couple of times before Mr. Alexander, was that in any way important to your diagnosis of PTSD?
No, if it was, it would have been included, but it wasn't. I didn't want to, again, it was irrelevant to my report.
Okay. And with regard to writing a report, when you are summarizing facts or summarizing your interviews with a client or patient, in this particular case, are dates important to you?
Dates are important as landmarks, but the specific chronological order, except, for example, on the day of the killing, that was important. Okay. On the day of certain events, that was important. But many other aspects didn't really matter because whether it happened before or whether it happened later was not relevant. If it's relevant, it's important, but it wasn't relevant to me. And that's the way that I've been doing it for a while, and it seems to work out most of the time.
And in your report, the ultimate diagnosis is for PTSD, is that right?
At the time that I evaluated her, that was the diagnosis, yes.
Okay. And whether or not you listed all the criteria or left a few out, does that change your diagnosis?
No, because in my report, I actually reproduced all of the diagnostic criteria, and then in one paragraph, I simply said, this criteria applies, and so on. But I omitted a couple of letters and a couple of numbers. But again, when I reviewed it, I saw the error and corrected for it.
All right. So I guess what I'm asking is it as though you added these things later on as you were getting prepared to testify, or is this added these criteria like, oh, actually she has this criteria too? Or is it that you already knew she had these criteria and you just didn't type it?
I didn't type the letters. I had listed all the criteria that existed, but I omitted a couple of letters and numbers that referred back to those. So obviously she wouldn't have made the diagnostic criteria if those criteria weren't met. But I forgot to type in those numbers.
Okay, so to you always had the criteria.
The criteria were always there, sure.
Okay. You were asked about the beginning of the attack to the end of the attack, and that her memory lapses from the beginning of the attack to the end of the attack. When you talk about end of the attack, when is it that her memory... What do you mean by when her memory starts to come back? Or the ability to form new memories starts to come back?
Right. I didn't express that in the best possible way. When I meant the attack was, and I did misstate it. What I meant by the end of the attack was when sufficient time had passed from the onset of the attack that she was able to, again, become consciously aware of her surroundings, which happened near that checkpoint towards the Hoover Dam. That's what I was referring to, and that's what she can begin to remember. So, again, the flood of the chemicals, suppression of the memory formation, pulling away from the scene meant that she was getting out of the attack. Although she was hyperventilating, she remembered. She came to and she was hyperventilating. And so she was still in the throes of a stress reaction, but it was obviously lightening up at that point, and she was beginning to get back towards a more normal state.
So if she formed no memories during the time from the beginning of the attack. So from the beginning of the attack, well, I guess according to her, it was after she shot the gun and he fell on top of her, and then she starts to run. Is that where things start to go?
That's when it seems to begin to really go downhill, yeah.
Okay, and is that something she reported to you consistently?
Yes.
So from that time to the time where she kind of comes to, as you said, at near Hoover Dam, none of those memories are there. Is that right?
Yes.
And so that would mean that she would not remember anything about the camera where she put it.
Just leaving.
Sustained.
Would she remember anything about what she did at the scene from the time that she talks about losing her memory or not being able to remember?
Whatever would be there would be very limited, and that's indeed what we got. A flash here, maybe, and I think I remember something, but I'm not sure. Foggy, confusing, but most of it is gone.
Okay, and when you say most of it is gone, is there? I'm trying to understand the fact that when you don't have a memory, is there a difference between, I think you were asked a question actually, between repressed memories and trying to get them back versus not being able to get them back? Is there a difference between, is there something called repressed memories?
Yes, there are repressed memories.
All right, let's start there. What is that?
These are memories that are painful to an individual. They try not to think about it. Some people are able to basically block them off somehow. And they would have a form of amnesia, some sort of transient amnesia. And those memories, however, still exist, coded in the memory. And in those cases, use of sodium pentothal, truth serum, hypnosis may be effective in restoring and pulling through some of those memories. And sometimes they reappear spontaneously. In a case of dissociative amnesia, the memories never form. There's no recollection, there's no recording. It's as if you have an empty disk drive. There's nothing on it, and therefore you can't retrieve it. That's different than if there was something on there and you tried to obliterate it, then you might be able to pull it out. But in there's nothing recorded. It's just not there.
How can you know the difference between repressed versus disassociative?
Well, you look at the circumstances that led to the amnesia.
Okay.
And what is associated with acute stress is dissociative amnesia. And that's based on the physiology that we talked about earlier in the week.
Okay, so in other words, when you see somebody who's undergone an acute stress to their system, that the physiological response, the flooding of the hippocampus shutting down, and then long-term memories never being coded.
Right.
That's disassociative amnesia.
Yes.
Okay, and that is a physiologic. Is that something happens that because it's something that physiologically happens in our bodies?
Yes.
And repressed memories, is that how do those occur?
Well, no one knows the exact etiology, but apparently if there's an area of memory that's troublesome to you, somehow the brain has the ability, and it's not necessarily anything we do on purpose. We're just so troubled that somehow those memories get partitioned off. And the net of it is that those memories don't bother us. And so the whole area is like cut off from the rest of the brain. And the thing is, though, that those memories still exist, but they're repressed. They're shut off. And therefore, under varying treatments or spontaneously, those memories can reemerge and come back.
So is it with repressed memories, it's a negative or a bad experience, but not necessarily something that would throw us into acute stress?
Yes.
And is that how you can tell the difference?
Well, in general, that's one way of telling the difference. I mean, there are a lot of distinctions.
Okay.
And understand, our knowledge of memory is still fairly rudimentary, but we have learned a great deal, especially in the last 10 or 15 years, about how the hippocampus stores memory in the brain. We know, for example, that with aging, the hippocampus shrinks, but with cognitive exercise, the hippocampus can grow new cells. So this is all brand new stuff, and we're learning more and more, but it's certainly only the beginning for our ability to get better control over these things.
All right, and based on what you know happened, something horrible happened on June 4th, 2008. Based on that, does that help you better able to tell us if Jodi suffers from dissociative amnesia versus repressed memory?
Yes, the probability is that she suffers from dissociative amnesia due to the presence of an acute stress disorder which prevented the memories of that incident being retained.
Okay. You were asked questions about acute stress disorder, and how is it that you can say she had an acute stress disorder when you weren't there to diagnose it 2 to 4 weeks after she experienced the trauma? Do you remember that?
Yes, I do.
Okay. And are you actually diagnosing her with acute stress?
There's a high probability that she did experience an acute stress disorder, and I base that in large part, 1, to the report of the memory loss, 2, to the condition of the crime scene, which reflected a chaotic, uncontrolled frenzy.
Okay, 3?
The fact that she exhibited great strength in being able to move Mr. Alexander's body back to the bathroom, back to the shower.
Because that tells you what?
It tells us that she was very likely flooded with adrenaline and had the strength to pull him. After all, he was quite a bit bigger than she was.
Okay. And so what does that all tell us then?
It implies the fact that she did suffer from a true acute stress disorder, and that during acute stress disorder, the occurrence of dissociative amnesia is very common. And going back to the fact that her story has always been that she doesn't remember what went on at that time, I would have to say that it's a very strong probability that she did experience dissociative amnesia.
All right. According to the DSM, can you specifically diagnose her? Because since you didn't talk to her immediately after.
No, and that's why I didn't use the diagnosis, but I did indicate that the conditions of the scene likely indicated the presence of an acute stress disorder which evolved into a post-traumatic stress disorder. And like we talked about with the media crater up near Flagstaff, there's a hole in the ground. We know at one point a meteor hit it. We can infer that by things that we know about how these things are formed. And so by going back and doing almost like a forensic analysis of that crater, we're able to, with a high degree of probability, assume that there was a collision of a big stone from space at one point.
Okay, using that same analogy, because you weren't there when the meteor came down, you can't, is it that you just can't say with, in a diagnosable way? I guess according to the DSM, you couldn't say it for sure? Is that how that works?
That's right. We can say with an all reasonable psychological probability, this is what happened, or this is what has occurred, or this is where the patient is diagnosed.
Okay. Okay. You were asked the question about spending 25 to 30 hours with her. Isn't that actually inadequate? And your answer was no. But you also told us that getting close to 30 hours, it starts to become therapeutic. Is there any concern that you were switching roles with Jodi?
No, I had no concerns about that. That's why I terminated the visits. I got the information I needed. There was no new information coming in, and therefore I felt that I had more than enough information to be able to finish my report. And actually I had some sessions after I finished my report because there was some new information that I took up in the addendum. And there was no point to be served. So I didn't continue. There was no need to continue.
All right. And you talked about what other doctors in your profession the time that they often spend. What are the times that are normally spent with evaluations, typically, I guess?
6 hours. There's some evaluations we do that can be accomplished in 2 hours. There are some, and that doesn't count, that doesn't include the review of the case materials, but actually sitting with the client. Some people might spend 10 hours, 12 hours, 15 hours. But as a rule, 25 to 30 hours is a fairly good stretch of time for an evaluation. Some people spend more. Depends upon the nature of the circumstances, and it's up to the professional, who you assume knows when to stop.
Oh, is there a problem?
Afternoon recess. Ladies and gentlemen, please be back in the designated area at 3:15. Please remember the admonition, you are excused. The record will show the jury has left the courtroom. Counsel, please approach. We are at recess. You may step down.
Thank you.